Now, after years of corruption and neglect, no one can deny that Nigeria is clearly in a healthcare crisis and cannot afford to continue with business as usual. But far from doing anything substantial to fix it, Nigerian leaders in the past regularly traveled overseas for treatment, displaying an apparent lack of faith in the health system at home, one of the most poorly funded in the world, but which most of their citizens have to rely on. But in November last year, amid a rising death toll and crippling shortages of qualified personnel, medical equipment and drugs, the Tinubu administration declared a state of emergency in the health sector. So since then, what have they done to improve healthcare in Nigeria? Has healthcare been brought closer to the people? Or is the stark message still that if you are struck down by a major illness and you want to live, you better find the money to go abroad for treatment? Well, for more on the state of Nigeria's healthcare system, I'm suitably delighted to say that I'm joined now in the studio by the Nigerian Minister of State for Health, Dr. Tunji Alausa. And you look pretty healthy to me.
Thank you, Charles.
So clearly that's not your personal concern. But beyond the obviously it's your job. I mean, beyond the broader, beyond your personal state, let's look at the broader scope. How would you describe the state of healthcare in Nigeria?
Thank you so much, Charles, again. Let me clarify and redirect this to Nigerians. Nigeria healthcare system is no longer in crisis. We have a president now, President Bola Tinubu, that believes a healthy nation is the core to harnessing our biggest asset. And that biggest asset is our human capital. President Bola Tinubu has done so much for us in the healthcare sector. We've pieced in together, we're overhauling, rejigging, and redeveloping our healthcare sector in its entirety.
So it's safe to say that it's still in crisis, but you're working to get it out of crisis.
It is no longer in crisis. Unequivocally, our healthcare system is no longer in crisis. And let me tell you several reasons why that it is. If you look, we came in, there was a big problem about Japa syndrome, people migrating out, going out of the country, that we have crisis in the human resource crisis. Well, what have we done? We've attacked this in multiple areas. We have a multifaceted approach. We've increased the number of people enrolling in schools, healthcare institutions, studying medicine, pharmacy, medical laboratory science, and all over. So we've doubled enrollment. As we're doing that, also in nursing, we've increased. From when we came, we inherited about 25,000 students were enrolling into nursing school. Today, we have about 68,000 students enrolling in nursing school, and before the end of this year, we'll be enrolling about 110,000 students in nursing school. Remember, we have a population of 220 million. Mr. President has said it over and over. We have to leverage this increased population to our advantage. We need to produce more, overproduce. We know people will go, but as we produce more people will stay. And as we now continue to fix our healthcare system, people will come back, and we're beginning to see that. People are now reporting all the bright spots in our healthcare system. Today, we have reverse medical tourism. Go to Lagos, go to the hospitals in Lagos. People are coming from India, from sub-Saharan Africa, even from Europe, to come and get healthcare in Nigeria. Getting surgical operations are cheaper. Today, you'll be glad to know that today we have almost 900 aesthetic offices, hospitals all around Lagos, all around Nigeria. People are coming to get plastic surgery.
Is that people in the private sector, or the people in the private medical sector, or people in the public sector?
People are coming even in the public sector. Go to Loot today. A cancer center, the National NSIA Loot Cancer Center, has the state-of-the-art equipment, whatever you can get anywhere in the world. They have linear accelerator, they have everything there. People are coming from sub-Saharan Africa to get cancer care.
But that's in Lagos. What about the rest of the country?
And that's it. We're moving all over the country. If you see, this is not limited to Lagos alone. We're even going to the rural area. We have dedicated funds. If you hear about our SWAP program, we're aligning what we have with our basic care provision fund, which has more funding now. with our development partners. We're aligning more, we're collaborating more to direct these funds to our primary health care centers. We're also directing a lot of this fund to our National Health Insurance Agency to increase coverage. Mr. President has mandated us that we should increase coverage today from about 7 million to about 50 million people who have health insurance. We're working on taking to FEC how we're going to overhaul our current National Health Insurance Agency to meet Mr. President's demand. He wants 50 million Nigerians to be covered in the next 2 to 3 years, and we have a plan to get that accomplished.
Right.
And well, beyond that, okay.
Sure, yeah, go ahead. Finish
beyond
what you're
that, what we need to know, this president, this is the highest number of budget we've had in healthcare sector in almost 24 years. Mr. President worked with us to give us the highest budgetary allocation to the healthcare sector in 24 years. We have more money now to invest in improving infrastructures in our hospital, buying state-of-the-art equipment in our hospital. And if you're following the news, Mr. President just approved building of 6 more additional cancer centers in each of the 6 geopolitical zones in the country. Beyond that, 9 more new diagnostic centers will be built on top of what we already have. So we are moving. Our healthcare system is moving along now. A lot of changes. If you ask people in the healthcare sector, a lot of changes have happened, positive, good, real, sustainable changes are happening. So we are not in crisis. We might have inherited crisis. Today, our healthcare, we've stabilized our healthcare system. Right. We're on a path, we're on a trajectory to sustainable, durable healthcare system that each and every citizen
well,
of
let me
Nigeria
ask you this. Is the president now getting his health care treatment in Nigeria?
That's a good question. Seeking healthcare is personal. It's your personal choice.
When it comes to the president, it'll restore confidence, wouldn't it, if he were to stop going abroad for healthcare and do it here in Nigeria?
Let me tell you something. I won't disclose personal presidential information in public, but the president is getting some of his care in Nigeria, and I can tell you that. Right. And I'm positioned to say, so I have that privilege, but I can tell you, Mr. President Bola Ahmed Tinubu is getting some of his health care in Nigeria. He believes in this, and he believes in Nigerian doctors. He believes in Nigerian providers. All those are the people providing his care. So irrespective of whatever people tell you, just take that. Those are nonsensical information. I'm sorry to say about that.
Right. Well, that's why you're the Minister of State for Health, and we want to hear it from your lips. Business Day newspaper, of course, recently described Nigeria as one of the most perilous places in the world to face a life-threatening emergency. I'm not talking about regular care. I'm talking about life-threatening emergency, whether it's a road accident on the highway or a sudden medical crisis at home. The paper said that the odds are stacked against survival. What is the problem there?
Charles, I'm not here to argue or to argue about false information that people are saying. Today, a lady just came to my office, a cancer survivor. She'll be going public.
I'm talking about medical emergencies. If somebody were to get into a road accident in the middle of a motorway, what guarantee is there that they will get fast, efficient treatment? If I was, for example, in the UK or in the US or perhaps even in Rwanda, there would be an ambulance service that would immediately get to the place. They're close to the motorway, and they would immediately take them to a place where they'd get instant treatment and improve their chances of survival. Yes. What would happen to someone? That's what the newspaper is talking about.
We're building our emergency medical services aggressively. 5% of the basic healthcare provision fund is being directed to emergency medical services. Now, we have a team in the Ministry of Health that we're working, actually beyond that, procuring new ambulances, designing new way, not just the traditional ambulance that you would see, other things that fit into our local system where people at the local community can have emergency transport ambulance service that will take them to the
So you're working on it, but it's not there yet.
No, we had some of them. We're deploying a lot of them. These are things. Remember, this government is 11 months old, and for what
I understand that.
For what we are tackling each of these.
I mean, nobody is saying you're not doing the job, but the point is, where are you now?
Where are we now?
Yeah.
We put process in place to add more ambulances to our stock. We're working with the local government, citing locations where we'll have some of these homemade ambulance transportation to our public health system. We're retrofitting a primary care system so that they can even be the first point of contact where care will be delivered to this patient. If you go to our Federal Medical Center, our teaching hospital, we have several state-of-the-art emergency room in all these hospitals. People are not just talking about the good thing in our healthcare system. Everybody just look at the bad thing, but then a lot of good things have happened.
Yeah, no. Nobody can take that away from you if that is what is happening. But what would you say right now to people who are sick and dying because they can't access the right medical care or can't afford it, but who voted for the Tinubu administration on the promise of better, more affordable health
We've
care?
expanded access to healthcare services in our country. We're putting more money in a tertiary, secondary, and primary healthcare system. Now we have, we have about 8,000 of the 34,000 primary healthcare centers that we have in the country. Before we came into government, only about 8,000 of them are functioning. Now we're expanding them, increasing the number to 17,000 fully functional primary care centers. We are mobilizing more funds through our SWAP program, a sector-wide approach program, where we're moving funds from our basic healthcare provision fund with some money from our development partners. We've gotten significant commitment. We're pulling those money, 55% of those funds will go to our primary healthcare center. And what will those funds do? Improve infrastructure, provide more money to buy medical consumables, medications, hire more manpower. We also, if you heard about the President Bola Ahmed Tinubu fellows, we're recruiting fellows that will even now go and do quality check at those primary healthcare centers in each of the local governments in the country, 774 local governments in the country, and come and report to us what they're doing. We've also gotten support of Mr. President that this basic care provision fund will be much more monitored. Right. The money that goes to the state, before they get the next tranche of money, they will account for the money we've given them. So there's more probity. Fiduciary, we're pushing more fiduciary responsibilities in the way these funds are being managed.
Right. So for people,
access to healthcare has been significantly expanded.
Right. But you have to admit that not everybody has, in fact, a significant percentage of people still are not seeing that. You may be improving, and as you correctly pointed out, and I mean that's a factual statement that you made. You've only been in office for 11 months. Well, let's call it 12 months now. This is the 12th month. So what would be your message to people who have not seen any improvements in healthcare since you came into office? How long should they wait for things to improve in the health sector?
I don't agree with that. People have seen significant improvement in healthcare. Go do your polling. People have seen, you are not, it looks as if you're living in a different world.
No.
I'm sorry to say.
I'm asking you a straightforward question.
People have seen there's significant improvement in our healthcare sector today. Today we've been working. Mr. President, we had some issue several months ago where, because of fluctuating exchange rates.
I mean, you're talking about people in the rural areas. You're talking about somebody who's living somewhere in the middle of the Niger Delta, somewhere who's living somewhere in the middle of, Sokoto, somewhere. I'm not talking about Lagos. I'm talking about across the country.
Our strategy is not only at the federal tertiary hospital or the secondary hospital. We're going directly to the rural population. That's where our pivot. It's a primary health care center. We're improving it aggressively.
Yeah, but as you continue to improve it, I wonder if you can give a time frame of how long people should wait before they see those improvements.
This is a continuum. The improvement is happening day after day. We're sourcing those primary care centers more. We're putting more money. We're working in different areas. We're working with, the president will be coming up with an executive order on how we're going to crash the prices of medications and medical consumables. That will happen in the next few weeks. We've mobilized international commitment on money going into manufacturing center to unlock a value chain. So it's like, it's everything is going in tandem. And if you look at it, significant improvement has happened. we're not there yet. But as a government, what we've been able to do.
Well, I'm glad you said you're not there yet.
Of course,
because you were sounding as though you're there.
No, we're not there yet. It's a continuum. But
Right.
if you look at the trajectory, we're on the right trajectory now. You see, Rome was not built in a day.
Absolutely.
But look at it, we're making progress. Look at 6 months ago, would you say the way things were 6 months ago is what they are today? No, there have been improvement. And if we're moving in the right direction, that means we will continue to make sustainable progress day after day. And that's the direction we're going.
Right.
I'm
Okay.
very pleased with what's happened, but we're not there yet. There's still a lot of work to be done. But guess what? We're in the right direction. We're seeing visible changes are already happening. When we have, you see, a significant amount of budget, we have money to spend, and go talk to our hospitals. They are getting significant budgetary allocation to improve this money will be spent on infrastructure improvement.
Right. Let's look at the deadly disease, malaria. I'm sure that's an area you'd like to talk about,
Yes.
something that kills around 500,000 children a year in sub-Saharan Africa, many of them in Nigeria. I understand you've been working on initiatives to accelerate the elimination of the disease in Nigeria. Tell us more.
Thank you so much. You see, we've had malaria burden since 1948, clear over 70-something years. And what's happened all this year is that we've been maintaining malaria. That is not acceptable to us. You've just quoted the high number of people dying. Beyond that, children, pregnant women, the morbidity and the economy loss to our country. This is just not acceptable to us as a government. So what did we do? We sat down and said, no, we cannot continue to just maintain malaria. Countries, in the last 10 years, several countries have eliminated malaria. Nigeria should not be an exemption. So what do? What we have now, before what we inherited, if we continue what we're doing before, I asked even our own team in the Ministry of Health, we'll continue for another 100 years, we will not be able to eliminate malaria. So what did we do? We said, no, we have to change course totally, do a 360-degree change. We design what we're going to do. We got a strategic advisor on malaria. We just finished our roundtable meeting, an international roundtable. We invited all our top partners that you need to help from us. We're going straight now. Our mission, our goal is elimination of malaria. And there's several things that you can do with that. Beyond commodities, you're giving medication to pregnant women, you're giving sequential chemoprophylaxis, you're doing all the case management. We now have to talk about prevention. We are running a whole of a government approach. In our strategy to eliminate malaria, we also have to get the Ministry of Education involved, get the Ministry of Environment involved, get the Ministry of Agriculture involved, because nutritional component is also an important part of it. We're talking about now, this is just not all commodities. We have to talk about what are the things that we need to now do, add all the tools that we're using together. Evidence have shown, clear evidence-based studies have shown that if you combine all the tools, you have a over 90% chance of eliminating malaria. Now, we're aggregating all these tools together, namely prevention. What do we do about prevention? We're using long-lasting insecticide nets for that. We're doing sequential chemoprophylaxis. We're going to be working with the environmental ministry to help clear our drains, and then we're also doing things like indoor residual spraying.
So it's a mammoth task,
yes,
isn't it?
Yes, mammoth indoor residual spray. We're going to be using larvicidal management, and then in combination with the other things, we now have to start talking about vaccine. Right now, there are 2 vaccines that's available in the market.
I was going to ask you about vaccines.
We now have to look at the cost.
Because, I mean, they're having trials in West Africa.
Actually, no trial. The vaccines are proven to be effective. They have about 60-something% efficacy rate. So but the cost of those vaccines are high. So we now have to decide, how do we do it? You go to one state in the country, we have a prevalence of malaria of less than 2%. We go to another state in the country with a prevalence of malaria of 53%. That's the highest prevalence in the world. Now, how do we mobilize our resources? We're looking at Nigeria as a whole now. You can't control malaria in one state and have a high incidence in others, and you say you're not making progress. So our approach now is that we're looking at Nigeria as a whole. Where do we align, where do we direct these resources to get the best effect, the best outcome? And that's what we're doing. And I'm pleased to tell you this roundtable meeting that we had last Friday was a phenomenal success. We've come up with nine action points on what we need to do in our strategy to eliminate malaria in Nigeria. This is the first time it's done. And we have to thank this president for that. He's giving us all the support. If you don't have that kind of support, you cannot begin to talk about elimination. And now, a big thing of what we're also doing is we're mobilizing our own domestic resource mobilization. We have to put our money we have to put our money where our mouth is. Before you can tell people, okay, where are you putting your own resources? We're working on innovative finance mechanisms to get more money to use in a fight to eliminate malaria in our country. And we will get that done.
Right. So given the hope that you've just put out there of this new vaccine and the promise of the initiatives that you're working on to accelerate the elimination of malaria in Nigeria, could we be looking at the end soon of this scourge in this country, and how soon?
No, you can't put a time to it, because you see, you've forgotten we have the highest burden of malaria in the world. We have a population.
Yeah, but you must set deadlines for yourself within which you aim to achieve certain things.
We're pushing out our strategies, all these interventions, all these tools we're working on, we're going to be using. It would be full idea of me to say today that, in 2 years we'll eliminate. It's impossible. I can't say that. And I will not come and lie to the nation.
Right.
So give us time, at least we have a strategy of what we're going to do here.
And what's a final word from you? We've got about a couple of minutes or so before we have to
Let me tell Nigeria our country is on the right direction. Please be patient with the president. The president is working so hard to move this country forward. He has passion this is what he's lived all his life for. We've seen what he did in Lagos State, and he's taking difficult decisions that no president has taken in 40-something years. Let's commend him for that. The country is on the right trajectory. We should be patient and we should comment. We've seen it already. Things are getting better, but we're not there yet. But we need patience to get there.
Okay. Minister, I want to thank you very much indeed for taking the time to come to talk to us. Dr. Tunji Alausa is the Nigerian Minister of State for Health. Thank you ever so much.